Hi, and welcome to another episode of the Cancer Now What vodcast, sponsored by Arizona Center for Cancer Care. My name is Jenny, and I am joined here today by three really wonderful women in the medical community here in Arizona, in Phoenix. Dr. Ashley Albert, who is a radiation oncologist with Arizona Center for Cancer Care. Dr. Jyoti Patel, who is an integrative medicine and peds physician with Arizona Integrative Medicine and Spa. And we have Terri Taylor, who is a registered dietitian with Honor Health's Virginia G. Piper Cancer Care Network. Hello, ladies. Thank you so much for being here today. I'm so excited that you were able to come and join us in the studio. I wanted to, before we get started, just do a little introduction so that everybody knows who you are and what you do and how it relates to cancer care in our community. So we'll start with you, Dr. Albert. So do you want to tell us a little bit about yourself and radiation oncology and what you do?
Yeah, absolutely. So I'm Dr. Ashley Albert. I'm a radiation oncologist at Arizona Center for Cancer Care. So my role in treating patients with cancer involves radiation, as the name implies. So about half of cancer patients will need radiation in some form. In my practice, treating almost every type of cancer. We see a lot of breast cancer, a lot of prostate cancer. So that's what I do.
Perfect. Thank you. Dr. Patel, welcome.
Thanks for having me, Jenny.
Do you want to tell us a little bit about yourself and your practice?
Sure. I've been a practicing physician here in the Valley for 20 years. As a primary care physician, I've seen patients from birth to grave. So I see pediatric patients and adult patients. And as a primary care physician, we're usually the first in line to make the diagnosis or talk to the patient about their diagnosis. Especially cancer diagnosis can be very difficult for just the patient and their family and their caregivers. Now, we also have to support them all the way through their treatment, their mental wellness, their post-care. So my journey through that allowed me to then not only be the initial person, but also the continuity of care when these cancer patients came in. I also added in integrative medicine into my feather in my hat because I feel like medicine should be more holistic than it is. And so I have more tools now to help my patient with integrative modalities like nutrition and movement and stress and modalities like meditation and alternative practices and really be able to comprehensively create a plan for them that makes them feel more comfortable.
Yeah, so important for cancer patients, as we know. I'm sure you help all of your patients in that way, but cancer patients especially need that extra support. So that's really good.
Sure.
Thank you so much. And Terri, how are you?
I'm well.
Good
Thanks
to see
for
you.
including me in this really important group.
Yes, of course. Of course. You are a very important part of this group. So tell us a little bit about yourself and what your role is at Honor Health with cancer patients in the community.
I'm a registered dietitian and I'm a board certified specialist in oncology nutrition. So that is the focus of my practice. I do patient counseling for people that are at higher risk for cancers, for people who are undergoing treatment, and for survivorship plans. I meet with patients and families on an individual basis. I do some community education as well. And again, just like Dr. Patel, I'm kind of there from the beginning all the way through. So, and trying to work on their nutrition plan as it changes throughout their treatment.
That's great. Well, thank you for being here. We appreciate it.
My pleasure.
So, full disclosure, my father's a gastroenterologist, so I always hear about how important nutrition is when it comes specifically to cancer patients, right? So can you, before we start talking about the specific diet that you are recommending, can we talk a little bit about the role that nutrition plays in the journey of a cancer patient, kind of set the stage there? I don't know if you want to start that, Dr. Albert?
Sure. So, from my end, I'm seeing the patient once they've already been diagnosed. And depending on the diagnosis, we're recommending whatever type of treatment is indicated. And so, nutrition plays a big role in helping the patient get through the treatment. If their body is not able to get the nutrients to help them through the treatment, we've shown across different types of cancer that weight loss is an important prognostic factor. And then after treatment, we talked about survivorship a little bit. And so after a patient has gotten through the actual cancer treatment, helping them kind of get back to their normal or better than normal for them.
Okay. Anything to add, Dr. Patel?
Well, I come from a different place. I'm seeing the patient at the onset. So patients come to you with all types of dietary patterns. Some really already on the healthy spectrum, some not so much on the healthy spectrum. So I try to bring compassion to the patient because they're already dealing with so many things, so many emotions, that food can become a place of shame and guilt and blame. And so I always like to talk about food as nourishment and what they can add in instead of really going right in and saying, demonizing food or restricting food or changing their diet too much. So I take a more slow coach approach and start to say, okay, let's talk about the things that you do have control over. Because one of the things, and me as a cancer survivor myself, I know how much that matters to have control over some things because you feel so out of control and so hopeless sometimes when you get a diagnosis like this, that you give them the onus of control by saying, let's talk about the things you can do. Let's talk about the things you can, ways to nourish your body, to heal your body, to support your body, to get more energy, to have more vitality, to feel more energetic. So rather than the scare tactics of, cancer is caused by XYZ, you need to stay away from it, more focusing on the things that can nourish them, bring them back to health, make them feel better. Cancer patients have so much fatigue, and they have emotional ups and downs, and they have insomnia, and they have gut issues, and sometimes food doesn't taste good. And there's just so many pieces to that. So being compassionate and understanding that every patient comes at a different place, they have different requirements, and bring a different aspect to nutrition rather than the didactics.
Yeah, and that makes a lot of sense to me too. So one of the reasons I do this show is because my sister was diagnosed with cancer when she was 24, and she ended up passing away. This was many years ago, but I remember so clearly that while she was in treatment, just getting the calories in was so important, right? And it didn't necessarily matter how. It was just keeping her nourished. And it was when she wasn't in treatment and trying to build, her life back, that it was about what can we do to optimize your health as somebody who's not in active treatment. So I think that that's a really good point that people forget, is that whether it's diagnosis, in treatment, before or after, right? It's a different place for everybody. So Terri, tell us a little bit about when the patient comes to you and how that works.
So yes, I think it's really important to understand that we need to meet patients where they are and see what their goals are and their interests are and what information they have, and work from there, because we want this to be a positive experience for them. It's not about what you can't have, it's what you can have, and how can we work with them to be proactive to minimize some of those potential side effects from the treatment that they're experiencing. There's a lot of information out there that is maybe not as accurate as it could be, and so we want to sort through some of that so that people can really make good choices with their eating. And again, trying to make it in a way that will correspond with the treatment that they're getting, because different treatments have different side effects and different ways of approaching things. So my job is to individualize their nutrition plan according to where they're at, what their treatments are, and going from there. And close monitoring and support is very, very important during this time.
So is every patient who is being treated at Honor Health's Virginia G. Piper Cancer Care Network being seen by a registered dietitian as part of their treatment plan, or how does that happen?
So everyone has the opportunity, whether they're through the Honor Health system, the Virginia G. Piper Cancer Care Network, or from around the valley, they can come and see our dietitians with our network.
Oh, okay. So you don't even need to be treating in that facility.
Correct.
Okay.
They do require a physician's referral. And then we do types of screenings in our clinics as well. So certain diagnoses that are very high risk automatically get referred. And then, of course, people who are experiencing problems where physicians are going to be referring them, they would all have the opportunity to sit down with us and do a nutrition plan.
That's amazing. What a great resource for our community. Thank you. Well, you all have told me that you are very passionate about one type of diet in particular. And I wanted to really just get some understanding around that and from all of your perspectives on it when it comes to helping cancer patients. So that diet is the plant-based diet. So we'll start with you, Dr. Patel. Why don't you tell me, what is a plant-based diet, and is it just another fad, or is actually a thing? Tell us what you know there.
So it's not a fad.
Okay.
And the basic idea is, I tell my patients this: how many steps did your food take from the earth to your plate, the least amount, and how long has it been since it left the earth, the least amount. So you're going to go towards a more plant-rich fruits, vegetables, beans, legumes, whole grains, seeds, nuts, with lots of color and variety, as fresh as possible and minimally processed. That being said, again, patients are coming at a different level. So I typically will say, add in one vegetable into your plate. Make one meal meatless if you can. Try to increase the amount of vegetables and fruits you have for snacks. So there are so many simple things that patients can do to be more plant-based. There are so many health benefits to plants. Plants carry intelligence, energy, and information. And all that energy and information we can consume through our plate, and then that intelligence helps us with our health. And color and variety and fruits and vegetables is the way to go. So no, it's not a fad diet. There's lots of studies now to support not just cancer treatment, but heart disease and diabetes and chronic inflammatory disease and gut diseases. All those things can be helped with a plant-based diet for so many reasons.
Excellent. Well, that makes sense.
I think it's important to point out that some people think that if it's plant-based, it's automatically vegan or vegetarian, and that is not necessarily the case. It's, as Dr. Patel said, it's predominantly eating foods that come from plants, but there is room for some of those people that, again, want to make a transition or want to include small amounts of animal products. They certainly can do that. Another thing that a lot of the research is showing now is that you can be plant-based, but if plant-based is more of an ultra-processed type of plant-based. I mean, sodas can be plant-based, but the idea is that we find that when people are eating whole plant-based diets, then they're having more of the health benefits than ones that are using a lot of processed foods in that plant-based eating plan.
Okay. So that's when you tell me you're 80 to 90% plant-based, that means that there's some room for some chicken in there or some fish or something.
Absolutely,
Okay.
absolutely. And everybody kind of comes at this with a different approach. And I think I initially was kind of skeptical. And when you hear the word vegan, that sounds very restrictive. And vegan kind of encompasses some other aspects as well. But I agree with what Dr. Patel and Dr. Terri were kind of describing. A whole foods plant-based diet is something where we're kind of eliminating the very processed foods. So vegetables in their true form, grains that haven't been stripped down, we're really kind of maximizing the nutrients. I personally really like the term plant-predominant. And the reason I like that is that there is room for that. So it doesn't have to be all or nothing. We've shown studies where just doing a meatless Monday can be helpful. Just cutting back, substituting one meal, take out the meat, add in some beans, things like that can be very helpful for patients and make strides in various aspects of their health. So for me, plant predominant was helpful. And like we were talking before we started recording, for us, we enjoy hosting people. We enjoy gathering. We enjoy grilling out. And so for me, I kind of shoot for 80 to 90%. Sometimes that looks like Monday through Friday, I'm eating mostly plant-based meals, and on the weekends or if there are special events, it's okay to have a little bit. We've looked at different cultures that have a plant predominant diet, and many of those cultures are living to their 80s and 90s, very healthy people. And so meat is just kind of a side, whereas the standard American diet, meat tends to make up the majority of the meal.
Okay, but it's not a no meat.
It doesn't have to be.
Okay.
And this can be a very personal journey, so everybody may approach it differently. For some people, they do better with all or nothing and they go all in. Some people do it for environmental reasons. But like I mentioned, for me, it's kind of easier to keep up with if I say I can have these little treats or sections at special occasions.
Okay, that makes a lot of sense. So how can a what did you call it? Not plant-based, plant-predominant diet. I have to change my notes.
No, we can say plant-based.
Okay. How can that be helpful to someone while they're in treatment for cancer?
Sure. So like we kind of talked about before, for me personally, it's something that I talk about with my patients, and I kind of let them bring it up. And the reason I do that is because we don't want to come from a place of shame. A lot of times when a patient has a diagnosis of cancer, they're very overwhelmed. So trying to do a complete overhaul on their diet may not be best for them. However, there's some patients, once they get a diagnosis, they want to be proactive. Maybe they have an early stage breast cancer and they're in their 40s or 50s. What can I do to move forward from this? So, I will talk about these things, kind of adapting it to each individual patient. During treatment, again, it's kind of getting in the nutrients. Having said that, there are certain foods that have been shown to be anti-inflammatory. We're causing inflammation a lot of times with our treatment, so there could be some things that they incorporate in. Maybe they get their calories from calorie-dense food, like they mix in peanut butter with their smoothies. So there are a lot of very helpful and healing plant-based foods. And then afterwards, kind of helping them make that shift, and what does that look like for each patient.
Okay. Anything to add around how plant-based diet can be beneficial for cancer patients specifically?
Yes, of course. So food is really, it's not just what you're eating, it's also how you prepare it, in the manner of your mood when you're preparing it, who you're preparing with, who you're eating with. So it's when people are going through this type of treatment, it's also important to address the emotional side of food and bring in that whole comprehensive view of where their food came from, how it was prepared, who was eating it with them, what's their emotion when they're eating it, are they joyful? So it's really a nice way to blend the idea of eating more plant-based foods, but also enjoying the food and bringing emotion into that food.
Yeah.
Especially when you're going through something as emotional as cancer treatment.
Yeah, and that's really just what I'm thinking about too. It's right. It's like you barely have an appetite and you are on a lot of medication and you're not feeling well, and eating is probably one of the last things you're thinking about, and all you can get down is an Ensure. How do you bring joy to that, right? Like how do you, it's like you really have to be thoughtful around I'm this is for my strength. This is for my, like you have to really find that. And I think
bring gratitude to the food.
Exactly.
Yeah.
Exactly.
So when you bring gratitude to the food and you bring joy to the food and you share it with people you love, whatever you're receiving is going to be nourishing, right?
For sure.
Yeah.
That makes sense. How have you found that this particular plant-based diet has been helpful to some people when you're taking care of them and they're in treatment?
So I think some of the things to think about are some of the side effects from some of the treatment actually can be minimized by including some of the plant foods. So one of the things that we do look at is sometimes from certain treatments, the immune system is really compromised, and we do know that our immune systems in our bodies really benefit from eating a lot of plant foods. So that can be one place where we can help them to strengthen their immune system throughout their treatment. Sometimes people are having a lot of bowel irregularities, and so by looking at different types of fiber that they eat, that can help to kind of mitigate some of those issues and help them with that. We do know now that the good bacteria in our gut, called the microbiome, is very important when we look at how people respond to treatment and what some of their side effects are, and again, their immune system and things like that. So we know that when you're eating a wide variety of plant foods, that's really helping the good bacteria in your gut. What's really important is thinking not only about like one plant food, but a lot of them, because we know that all the different bacteria in your gut feed on different types of plant foods. So more variety, more being fed rather than left out.
Sure.
Some other things, again, there is some research that shows that fatigue can be related to what you eat. And so when you're eating some more whole plant foods rather than some refined foods, your energy level may be better as well. And as Dr. Albert was mentioning about some of our breast cancer survivors, some of those patients who may have estrogen receptor positive breast cancers are on medications that can give them things like bone loss or hot flashes or things like that, joint pain. And so we know that the plant foods can be anti-inflammatory, and that can be very helpful. We know that plant foods are very important for strengthening our bones. So again, I think it's important to think about what some of the side effects are and how we can use the plant foods to help minimize those side effects and help them to feel better and feel more in control again of what they're doing. And then when we look at the long range, we are finding a lot of research now that looks at the idea of survivorship and reduced risk of recurrence, especially in colon cancer and breast cancer and prostate cancer. And then we know too that there can be some comorbidities from some of the treatments. Some patients may have along the way some heart issues from some of the treatments that they have received. So a big field now is called cardio-oncology. And again, that combines the eating and lifestyle part of it to help to keep their heart strong and keep their risk of recurrence of cancer better. Another thing is when we're looking at treatment and foods and those types of things, it is, again, food is not only a physical thing, it is an emotional thing. And so a lot of foods bring us joy. We've heard about different hormones in our bodies that maybe are better. Our happy hormones are better by eating certain foods. Or some of the treatments can affect your brain, and you may not be able to think as well or concentrate as well. And we know that many eating patterns, like the MIND diet and some of those, have really been shown to help to strengthen the memory and attention and actually decrease depression.
Oh, okay. That's interesting. So is there a plant that you can eat? I mean, if you had to say, if you don't want cancer, eat this plant, right? Is that a thing? Like, does that exist? And what is it if it does?
I would say eat plants is the thing, okay? Because unfortunately, one item would have a benefit for certain cancers, but they all have what we call the phytochemicals or plant-based compounds that are naturally found in the plant foods that work in many different ways to reduce the risk of cancer and recurrence. And so just eating more plants is what I would say to that.
I agree. I think that it's the entourage effect of the whole plant. Because oftentimes we want to isolate a vitamin or a mineral or a supplement. I get that often in my practice. Patients want to know what supplements they can take. And that's okay, but it doesn't replace the entourage effect of all the phytochemicals, right? The bioflavonoids and we talk about these different kinds of foods like cruciferous vegetables and the lycopene from the red vegetables and the carotenes from the orange vegetables and the green vegetables and getting azelaic acid from some of those fruits and getting green tea and herbs like parsley and cilantro and adding in spices like turmeric. So it really isn't just one nutrient that can help fight cancer, it's the whole army. Yeah. And if you think of plants as having their own sort of defenses against the environment, they're loaded with these weapons that help fight against inflammation. They're antioxidants, they're anti-inflammatory. So when you eat, you should eat a variety, you should eat the rainbow, and you should rotate. Because if you get stuck and fixated in one particular type of food pattern, you're not only going to minimize the growth of your microbiome and the diversity of your microbiome, you're also going to limit the number of nutrients you get in. And a lot of times what we know about plants is you have to combine them. So if you're trying to get a whole protein, oftentimes you can't just have one plant. You have to have like rice and beans together to get a complete protein. Soy is a complete protein. But there are very few things in the plant life where you can get everything in one thing. It really does require a potpourri of diet, for sure.
I think, too, that variety is important because you can start out and be really motivated and going, oh, I'm going to eat broccoli every meal and all of that. But then you get sick of it. And so the importance is the sustainability of all of it. Right. And so when there's more variety and you're using a lot of different plant foods, the likelihood that you're going to continue to do it is greater. And we can't forget about the taste of food and, again, the enjoyment of it. So the idea is trying to use a lot of different spices and seasonings and different plant foods together so that, again, you can enjoy it as well.
So if you want to transition to this type of diet, right? I'm sitting here thinking, well, this sounds really good, but like just like every other working parent in America, right, has to figure out a way to do all the things and still put healthy food on the table. So you get very stuck in these repetitive patterns. That really resonated with me, Dr. Patel. So how do you, I get that you're saying add it in instead of taking things away, but how do you know what to add in, right? Like do you just go to like buy one of everything at the grocery store? Like I don't even know where I would start. It sounds very overwhelming. Like where do you start with that?
So I have 2 children and I also see pediatric patients. So I understand the nuance of trying to give kids foods that are healthy for them. So with my daughter, for instance, I'll let her have what she wants for breakfast, but I'll say, I need you to eat one thing that's alive.
One thing that grew.
One thing that grew, exactly. And so that could be just the banana that she has or an apple that she has, or she'll agree to put some lettuce on her burger, things like that. So I don't take away any of her joy. I just say, okay, I need you to pick one thing. And in the same way, I would say the same thing to you. Jenny, think about the fruits and vegetables you really love to have. Maybe it's a whole grain, maybe it's nuts and seeds that you want to add in a snack. So just find one thing that you want to try to incorporate into your snacks or your meals. And don't go out and buy a bunch of stuff because it's probably going to rot in your vegetable drawer. That happens to a lot of people, including me.
Yes.
So start out simple. Maybe just say, I'm going to be working on breakfast this week. And maybe you have eggs for breakfast every morning, and that's your thing. And maybe tomorrow you'll think, maybe I'll add some spinach to my eggs. Or maybe I'll add some peppers to my eggs. Or maybe I'll add a slice of avocado. Something as simple as that is already moving you towards your goal. I love the book Atomic Habits, and it talks about tiny habits. So in order for something to be sustained long term, you can't make big leaps. Actually, what studies show is that when you make small, tiny changes that are almost insignificant, they're more likely to stick. And then you take that habit and you add more things on. And, as was mentioned earlier, you may want to take out meat from one meal and add beans or make substitutions. So think about that as you go forward. And of course, as the audience thinks about their own meals, where can you add in one thing that's alive and that was grown?
I love that. That makes a lot of sense. Thank you. Did you want to add anything?
No, I completely agree with that. So I think most American families they've found have the same maybe 8 or 9 meals on rotation.
Yes.
So just like we said, maybe just start small with one of those, and you don't have to go out and buy vegan cheese or vegan this and vegan that. Just think about, just like Dr. Patel said, just kind of incorporating one thing. Maybe it's beans instead of the ground beef or whatever it is. And there's so many great resources now, and I think it's helpful when you just keep it simple. It can be very intimidating. There's a lot of very involved plant-based recipes, but I think just keeping it simple is going to help with the adherence to it.
Yeah, that definitely was what was going through my mind. And I was thinking about my 3 kids and how, I just don't know.
And you have teenagers.
And I have 2 teenagers, and I have an 8-year-old. And the boys at this point, they'll eat whatever I put in front of them as long as it's edible. And sometimes even if it's not. So if we're working on this transition to a plant-based diet, to your earlier point, I just want to make sure we don't have to give up everything, right? We don't have to give up eggs. We can have our eggs, just add the avocado. We don't have to, we can still eat the things that bring us joy in other ways. Like I want to be healthy, but I don't necessarily want to be a vegetarian.
Yes, exactly. And like we said, it doesn't have to be all or nothing. And with eating like anything, there's, what we talk about opportunity cost, right? So if we eat one thing, if we fill ourselves up with, prime rib, we're going to have less room for the vegetables. And that's not to say you can't ever enjoy some red meat, but it comes down to kind of just incorporating more of the vegetables so you can get all the benefits, across the board in terms of cancer, heart disease, inflammatory conditions. You will find cardiologists, rheumatologists, primary care doctors, all more and more supporting this plant-based or plant-predominant diet. And so, again, it just, maybe you cut some things out, and that's not to say you have to completely restrict or you can never touch it again or that it's evil, but it just gives more room in the diet for these healthy, nutritious things. We don't have so many specific dietary deficiencies anymore. For example, vitamin C deficiency was a thing at one point. But really for the American diet, we are deficient on fiber. So we've talked a lot about different plants, and fiber comes from all of those plants, legumes, more so than it does from animal products. And fiber has been shown to have a number of benefits: lower cholesterol, lower glucose levels, better or improved insulin resistance. Fiber has also been shown to decrease risk of colorectal cancer, breast cancer. So really giving more room in your diet to get those really healthy, protective things.
Okay. Is there any risk to following this type of diet when you are going through cancer treatment?
So really there are no downsides to eating more plant foods. I would say, again, if we have patients who are having physical issues with eating, depending on where their cancer is, yes, then, if they're having chewing problems or they're having, issues with a lot of bowel irregularities and things like that, we would probably liberalize from there and try and include them, those types of foods, in ways that they could tolerate them. would be important. So the type of fiber, or again, maybe they can't eat salads because they can't chew, but maybe they can drink a vegetable juice, or some of those things would be things that we would modify for that, of course. And of course, we are really looking at optimizing their nutrition throughout their treatment. One thing that we look at a lot at now, not just body weight, but we look at body composition and the importance of maintaining muscle mass. And so finding proteins that are helpful to do that is where we would work with patients and see how they can incorporate that type of protein in as well.
That's a great point, because, and I want to ask about this. So you hear also, right, in the media or wherever, right, because you don't get the facts, you just get what you're told. And so soy protein, right? People talk about that causing breast cancer if you eat too much, but that would lend itself to this plant-based diet, right? So how do we deal with a question like that?
So this is what I tell my patients. If your soy is organic, whole, in its natural form, it actually is very therapeutic, and the studies all support it. And if you eat fermented soy, like tempeh, miso, sauerkraut's not a soy, but tofu, any kind of fermented soy products, they're also good for your gut microbiome. So the soy products that I tell my patients to stay away from or minimize are things that are processed soy. So soy milk, soy cheese, soy yogurt, soy chicken nuggets. So anything that's made in a factory, again, going back to nature, sticking to a whole plant-forward diet as opposed to eating things that are ultra-processed or processed. And Terri even mentioned that as soon as something gets processed, again, it changes the constitution of it. And that may be where we're seeing some harmful effects on the body, is the processing, not the soy.
So edamame is all good.
Organic, whole
good.
edamame.
But then when you go to a restaurant, right, and it's prepared in this delicious garlic sauce, like how do you know if that's processed, right? How do you know what you're really putting in your body unless you talk to the chef?
Again, it's about how you eat, where you eat, who you eat with. So if you're in a sushi restaurant with a bunch of friends, or you're with family and you're enjoying yourself and that garlic sauce is just so yummy and you're receiving it and it's not something you do every day, then fair enough.
You're good.
But if you're going to the store and every week you're putting on your shopping list soy cheese and soy milk, I would say maybe think about alternate ways to nourish your body.
Excellent. That's super helpful.
And I'll add too that it's confusing for doctors and confusing for patients, because we hear soy, estrogens, risk of breast cancer, but that's since been debunked. So the estrogens that soy contains are actually phytoestrogens, and they don't work on the receptors, the estrogen receptor, in the same way that our natural estrogen does. And if you look at populations in Asia that have a lot of soy intake, they actually have lower risk of these cancers.
Interesting.
So I completely agree with Dr. Patel in getting that unprocessed soy. And so just kind of understanding where that fits in.
That's really...
Also, there's been research that it shows that it reduces the risk of recurrence with breast cancer as well by including some soy products. And again, soy products, when they're in their whole organic form, can be helpful for your heart as well, and your cholesterol and those types of things. We're not looking at buying, soy pills or using highly concentrated soy protein powders per se, but again, we're looking for organic whole sources of soy.
Okay, good. So you're safe if it's real, basically. So are there benefits to a plant-based diet specifically when someone's going through chemo and radiation? I know we've talked a little bit about how all the different plants have different nutrients that can support the body, all the time. But is there something going on with that particular diet when you're in an active cancer treatment, radiation or chemotherapy?
I would say yes. There's been studies that have come out that show that switching to a plant-based diet or even incorporating more fiber from natural sources has been shown to alter the actual genetics of the cancer itself. So if we take a step back and think about cancer are cells that are divided. They're kind of running wild. They are kind of bypassing the natural checks and balances. And so, when a cancer cell develops this mutation, eventually if there's enough mutations, it can escape the body's immune system. So the body is constantly surveilling for abnormal cells. And so they've shown in cases such as prostate cancer and even breast cancer, if a patient kind of switches to incorporating some of these things, they can actually kind of slow down the progress, or maybe their cancer doesn't progress to a more advanced or aggressive form. So getting back to your question, I think incorporating some of these things during the treatment could be very helpful. And they've shown that patients that do that actually have a lower risk of recurrence. And I think that kind of is attacking the cancer at different stages, if that makes sense.
Yeah, for sure. Definitely. Anything to add there?
The other thing about plant-based or plant-forward diets is they tend to be lower calorie, and some of the studies even support that as a therapeutic modality, especially if obesity or weight is an issue with patients going through treatment. Sometimes a low-calorie diet has been shown to actually support the treatment as well as recurrence. So I find that a plant-forward diet can give them bulk, can give them fiber, can support their gut health, can decrease inflammation, can be powerful antioxidants, can have epigenetic changes, but it also can then fill up the patient and give them fewer calories to help them also reduce other risk factors like obesity and diabetes and higher glycemic loads and things like that can be a contributor to cancer. Don't you agree?
Mm-hmm.
Yeah.
Interesting. Very interesting.
I think too, there are a lot of studies in infancy now that are actually looking at different pathways with cancers and different treatments that work on different pathways. So we're looking at, what is the insulin response in the body, and certain pathways, when those things are altered, can be helpful for determining drugs that can be used. But again, your foods can help support that as well. And again, there's some small studies that are looking at things like, okay, if we're using fermented foods or fibers, does that change the microbiome so that the treatments are more effective, especially in things like immunotherapy, which is really the up-and-coming type of treatment when we're looking at systemic treatment. So I think that is something that we'll see a lot more going forward.
Okay.
And I think, too, though, we have to remember, again, not to stress patients out or to make them think that, I can only eat plant foods. And again, it's a mix of that and how we can do that in a comfortable way, in a way that still meets their goals and helps them to get through their treatment and serves as a foundation moving forward.
So how do we help people understand how to do this, right? I know, so you brought some books with you,
Yes.
Dr. Albert.
Yes.
When you have people in front of you, your patients in front of you, and they're like, that sounds good, how do I get started? What's the first thing?
So can I talk about these
Of
books?
course,
Okay,
yeah.
so these are ones that
Not sponsored.
not sponsored, no affiliation, just helpful resources. And all of these people are on social media. This first one is called Plant You, and I really like this one because the recipes are very, very simple. So, for example, there'll be pictures. I know what a banana looks like, but for some reason, having a picture of each ingredient is very helpful. And so this is a nice way. So, for example, Jenny, you could totally incorporate one of these meals for breakfast or dinner. Just try it out. See how your family likes it. So I told my family, I'm trying this new thing. Tell me what you think, and not to force it on anybody.
We'll have to tell my husband because he does all the cooking.
Yes, so there's videos on social media, lots of great stuff here. So I really like this one, again, because it's simple for me, not intimidating. So this has been a good resource that I share with my patients. This one is just fascinating to me. This is called Fiber Fueled, written by a gastroenterologist. We touched on the microbiome a lot. This one really gets into what specific types of foods affect the microbiome, talks about cancer, talks about how your microbiome can predict how you respond to cancer treatments. But again, kind of coming at it from a way of how can we incorporate more of the good stuff. So this is a great resource. And then this one, if you're a numbers person, also very interesting. So How Not to Die. This was written by a physician. He is the founder of nutritionfacts.org. He's got a lot of good information, videos, recipes. So really any ailment that you may have, there's something written about it. And Dr. Greger has a system, it's the stoplight basically. So red light, yellow light, green light, and kind of like what we were talking about before, green light, good to go as much as you want. The plants, it's not processed, it's closer to the earth. Yellow light is maybe a little more processed. And then, red, they consider certain things. So green, good to go. Just it's basic, but it's helpful so that you can kind of give yourself a little allowance here and there.
Great. Well, I love reading those kinds of books, so I'm excited to pick those up. Thank you. Any other resources that you can think of that you share with your patients?
Oftentimes my patients like visuals, so I will send them links to social media influencers that are cooking plant-based foods. A couple of them, again, no affiliation, but Vegan Richa is one that I really like, and I like her cookbook as well. But she shows very quickly in a minute how to make a meal. So simple.
That's nice.
And there's another one. She's young. She's really fun to watch. Fit Mind Green, and she's this young 20-something that always puts together these vegan meals with plant, and she'll make things that are straight from scratch. But she can make things like buffalo wings, and she can make things like meatloaf, things that people really resonate with as part of their soul food.
Yeah.
But she makes it kind of fun to use plant-based ingredients to make those foods.
Okay.
So whether you're a fan of certain kinds of foods like burgers we talked about, she'll show you how to make things very quickly. And the nice thing about videos on Instagram or TikTok is that they're only a couple minutes long, and you only have the attention span of 2 minutes, which is my style of cooking, by the way. So that's usually what I drive my patients to. Say, hey, check out these influencers. They're making these great videos in 2 minutes how to make a great meal.
Oh, that's really cool.
Yeah.
I'll have to check that out for sure. What other dietary and lifestyle changes can help protect against cancer in addition to a plant-based diet?
So of course we have to remember physical activity being a very important part of this as well. So looking at, again, are people maintaining muscle mass? What are they doing for activity? So I would say that's very important. When we're looking at alcohol intake, that is, again, a big risk factor for many cancers, so we need to look at that as well. We need to be looking at, again, mind, body, spirit kinds of things. So again, are we looking at mindfulness and gratitude and meditation and those things? Those are all things that are very, very important. And of course, some things like smoking would be another thing that we would be looking at in terms of trying to reduce risk for cancers and recurrence.
I would add things like sleep as well. It's very underrated. Most Americans don't sleep. And sleep is not a place you go to. Letting go of that hypervigilance and hyperarousal is falling asleep. And if sleep wasn't important, we would have evolved out of it since the time of the dinosaurs, but we haven't. So it's an active process of detoxification, of cleansing, of immune stimulation, of repair. So I really emphasize really getting them to this place where they can let go of that hypervigilance before bed. Do a lot of sleep hygiene work with my patients, turning off their tech, turning off the lights, cutting out the food and the alcohol, especially right before bed, stopping work and not getting on their computer or their phone and their TV, or all three, by the way.
Yes.
And getting people into this nice sleep routine. There are other things like chronic diseases that I deal with my patients a lot that also have an impact on patients' cancer risk, like their diabetes, like obesity, like other inflammatory conditions that may be contributing to the pool of disease. So really helping them manage all those other things as well. So I always say cancer is just one small part of who you are, right? Right now, it's not even who you are, it's what you're dealing with. Everything else still matters. So I try to have them focus on the whole picture of who they are, who they hang out with, their family, their friends, their vacation plans, their dreams, their aspirations, their purpose in life, who they love in their family, how do they connect with them. We, in our clinic, we do mindful-based stress reduction, so I teach those classes in my office. And there are over 6,000 studies to show that a regular mindfulness practice can help with cancer recovery, can help with anxiety, depression, insomnia, chronic disease. And mindfulness is being used in hospital systems, Navy SEALs, military, Fortune 500 companies, school systems, healthcare facilities. So, again, having the whole palette of things for your patients so that, yes, their treatment and recovery is important, but not to forget that they're still a person.
Definitely. That's a great point.
I think, too, along that line, stress management is a big part of that as well. And, weight management would be other things that would be included in those lifestyle practices.
Yeah, the stress is one that I think all of the people at this table definitely are trying to get a little reduction in. So I think that those are really good tips and super helpful. Anything else to add, Dr. Albert, around lifestyle changes or things other than plant-based diet before we wrap it up?
Yeah, I mean, agree with the exercise, of course, and everything that was mentioned. And I think it's really helpful to have kind of a team. So a lot of times patients can feel like their care is fragmented, or maybe we got them through the treatment and then, what now? How do I kind of get back to my best self? So I think coming at it, like you mentioned, from a very holistic perspective is very helpful. And sometimes that's easy to kind of brush off because we hear these things, meditation, wellness, what does that mean? But I think it's really important to look beyond just the treatment itself and kind of moving forward and health as something that's the overall picture.
So if a patient is listening to this or watching this and they want to understand more about it, is the best way for them to ask their doctor and see, what they say and suggest? I mean, are all doctors on board with this, right? Like how do you make sure that you are being your own advocate in this space?
Sure. That's a really interesting question. And I think in the medical field, and I'd be curious to hear what Dr. Patel thinks, I don't think this approach is necessarily the predominant way that it's approached. And part of that is because we've become ultra specialized. I mean, our field, for example, is, we use a lot of technology and we're very, very kind of niche. So I think taking a step back is very important. But to answer your question, I don't know if every, even oncologist is going to, be necessarily familiar with this information or see the benefits. But I think patients are being their own advocates. I mean, we certainly see that, especially in this community. Patients are reading. So I think this type of information is important to get out, not only for patients, but just for people in the medical community.
Absolutely.
I think it's important that we not only educate patients in this forum, but we also educate healthcare providers. And I come from a traditional MD training, 20 years of primary care, and my eyes were opened when I entered into the field of integrative medicine. And I was very myopic. I'd walk in, I had 15 minutes to see the patient, I had lots of paperwork. I was inundated with a lot of other things, so I just was running through my day. I was compassionate, but I wasn't always present, and I can be honest about that. And I think a lot of physicians can relate to that. We're busy, we have very little time with each patient. We don't have the bandwidth sometimes or the knowledge to support them. So we need to partner with people, right? We're not living in a silo. We're living in a community of other healthcare providers. So it behooves us as physicians to know who in our community is offering, nutrition, who in our community is offering counseling, who in our community is offering some physical therapy for the person who has had a mastectomy, who's offering integrative health, who's offering mindfulness classes. Anything that is in your community, we need to start to learn more about it. So I think the onus goes on both ways.
Yeah, I definitely agree. And that's always one of the main focuses of this show is to help physicians and practitioners in our community get together to have these conversations, but also for people who are watching to understand more about maybe what they're not hearing from one physician, and get a bigger picture. So I thank you all so much for being here. Such a great conversation. And I thank you so much for watching and listening to us today. If you'd like more information on Dr. Ashley Albert, radiation oncologist, you can go to arizonaccc.com. If you want some more information on Dr. Jyoti Patel with Arizona Integrative Medicine and Spa, you can go to aimsforwellness.com. So that's AIMSFOR wellness.com. And if you want more information on Terri Taylor, who's our registered dietitian with Honor Health Virginia G. Piper Cancer Care Network, you can visit their website at honorhealth.com/cancer. Thank you so much, and we will see you next time.